Margot.
Hey, Bill, Margot Wutan from the Center for Science and the Public Interest. One of the things that we didn't talk that much about today is parental responsibility as the scapegoat for addressing food marketing to kids. That, we hear over and over again from the food industry, well, it's really up to parents to buy that, and yet they spend $2 billion a year marketing to kids. If they didn't think kids influence food choices, why would they, or food purchases, why would they spend all that money? So I wonder how we help parents. Well, the other part of it is parents have bought into it. So parents do think that they are pretty much completely responsible for what their kids eat. I don't know who these parents are, because certainly as a mom, I don't feel like I had complete control over what my kid ate, at friends' houses, when she goes out, when she's at other people's houses, at school, at aftercare. All these other people were feeding her all the time. So I'm not sure how these parents have such complete control over what their kids are eating, but I wonder how we help parents to understand that, of course, they're responsible for the parts that they're responsible for, but that these food companies are turning their kids against them. They're embarrassing them. They're causing their kids not just to have a fit in the grocery store, but to expect to be fed a certain way. They cause tension between parents. They cause the shopping to take longer. How do we help them to understand how they're being undermined, or how the companies are interfering with their ability, their freedom to feed their child the way they want to?
Yeah, I think it's a good point. I think that one of the best things that CSPI did was the publication on pester power, because if we can characterize the effect of media and the promotion of food advertising as an issue which divides families rather than unites them, we may have a shot at it. But I'd be interested in other folks' responses to that. I mean, you may have. You often have your own ideas when you ask me questions, so I'd be.
Well, this one actually, we've asked for some funding to try to figure it out, because the parents we're so oblivious to the marketing. It's such a part of everyday life. I don't know if from Disney's perspective or from the tobacco perspective, how do you get over that hump of the sole solution is personal and parental responsibility?
Well, I think somehow unlocking or unpacking the Tyson ad more broadly would be a good start. That was really a disturbing ad. And how do we capitalize on that to turn the conversation? And maybe that's a strategy that a group which has a broad population base could do. That's a perfect subject for a blog. Kelly.
So Kelly Brownell. Bill, you mentioned the issue of media literacy, and this has come up a number of times throughout the day. Things that concern me about it is, first, who would pay for all of it if you were going to be done enough to really matter? Second is, could we ever begin to do it well enough to counteract what the industry is doing? But the other thing that's sort of galling about the basic approach is that you're letting people be exposed to a toxic influence and then expecting to teach them skills to counteract it, and that's not basic public health. So, for example, we could allow unclean water and teach people water literacy, and they want them to boil it and do all those sort of things, purify it in some way, or we just have clean water. So it would make so much more sense to get rid of the toxic influence in the first place. Now, I realize that there's the First Amendment and all kinds of other things and the massive commercial interests that don't permit that to occur. But in some ways, I'm worried that the media literacy is a way of letting the industry off the hook, and that it's a trap they would love us to walk into because they know we simply can't compete with them.
Well, that's a fair comment, I think. Certainly the experience with media literacy in the past, and I'm certainly not up to date on it, was that it was very weak. But I think we're in a different era, and that there's a different media that we're talking about. So until Sam is named to the Supreme Court, I think we're going to have to think about multiple strategies, and I would not put all my eggs in that basket, but it's one that I think we need to explore.
Bill, Joe Thompson, I think I had 5 points that you hit on. I think just backing up one step, I think we've been exposed today to a really fundamental shift in how our children, maybe we, will get information in the future. We're leaving 6 decades of mass marketing through television communication, which has shaped our culture and our nation and in part the world to now a multi-level, individually tailored, electronically immediate media revolution. And I think our research approaches, our framework for evaluation, our surveillance efforts are really going to be challenged so that we even keep up to know what's going on. I mean, I was really sobered this morning because suddenly I see what my teenagers are doing, and I thought I knew what they were doing. So I think it's more than just another. I think this is an evolutionary transformation of information, and we're struggling with a piece of it that we see a major threat. But it's going to be much deeper and broader. And if we can tie it to other movements, I think we'll be more successful. But I don't even think doing that without recognizing how fundamentally transformed our media formats are likely to be in the next 5 years.
Yeah, I quite agree.
This is Jill Fleischhacker, NIH. I think Kelly was echoing what I was bringing up earlier in terms of this, is it really counterbalancing? And so to that, I think, Bill, you might have access to data that I think would be closest to answering this in terms of the CPPW grants, in terms of the balance between environmental and policy strategies, and there was money or, approved approaches for social media. And I think most of the ones I've had access to learning about, it was an integrated approach of those three, not just one so much on the social media. So I was wondering if, using that example where you can talk about where this media, counterbalance stuff would work.
I wish we had some good outcome data from CPPW. I think the CPPW is the Communities Putting Prevention to Work, which was the first community-based interventions on nutrition, physical activity, and tobacco funded through the Affordable Care Act. And those have now shifted to community transformation grants. The problem with CPPW was that so much money came to the CDC with so little time to get it out that there was inadequate time to put a baseline evaluation in place or collect baseline data against which those interventions could be compared. And in addition, there was not enough time to really be even modestly prescriptive or provide choices about what those interventions should look like. I think that we're much more likely to have those data from the community transformation grants, but not in the near future. I think that's an accurate description, but remember, I've been gone from CDC for 6 months now, or 5 months, so they could be, I could be mistaken. All right, well, I'd like to close this by thanking all of you for your participation in this, and again, thanks to the staff who organized it and the speakers and the panelists and moderators. This was a great day. Thanks so much.
Good one.